This chapter will explore currently available options for pneumococcal vaccination. These vaccines protect against bacteria known as Streptococcus pneumonia. In children, this type of strep is responsible for cases of pneumonia, bacterial meningitis, and can also cause septic infections. In adults, strep is also notable for causing otitis media, sinus infections, skin and soft tissue infections, and other more rare forms of infection. Let's get a few things sorted right off the bat. First of all, pneumococcal vaccine is not part of many countries' vaccination schedules. It's relatively new compared to others, and newer versions are still being developed all the time. For the same reason, we don't have as much data on its efficiency and safety, making it more difficult to fit it in properly. Strep infections are very common throughout our life, not just in childhood. Hence, it's advisable for adults to receive pneumococcal shots as well, especially for elderly persons. There are two main versions of this vaccine, the differences between which will be discussed later. Now let's start with the pathogen. Streptococcus pneumoniae is a gram-positive spherical bacteria. It has a polysaccharide capsule to try and defend itself, which we conveniently use as a vaccine component. There are currently more than 90 known serotypes of pneumococcus, and their polysaccharides differ. One other reason for non-mandatory vaccination I failed to mention is based on this knowledge. Different serotypes circulate in different regions. Available vaccines cover only select ones and thus can only be electively used in certain countries where those serotypes are prevalent. Mode of transmission is predominantly airborne. Sources of infection are humans. Pneumococcus can be transmitted from acutely sick and from asymptomatic carriers. Some people can develop chronic sinus infections and be a source because of that. There are three main clinical forms of pneumococcal infections in children: pneumonia, meningitis, and sepsis. We just discussed pneumonia in our Hib vaccine talk. As far as other two goes, the bulk of it will be discussed later when talking about bacterial meningitis. I'll excuse myself from repeating the same information again, except for accentuating the significance of those infections. First of all, pneumonia. Any major respiratory problems in children are problematic. Strep pneumonias tend to cover entire lung lobes, spread to more than one lobe, or even cover an entire lung, or maybe even both. In children, reactivity to infection is generally worse than in healthy adults, and thus it's common for more than one lobe to be involved. Luckily, strep pneumonias are not as common in children as in adults, but it's nonetheless worth it to vaccinate against. In adults, strep is the most common cause of out-of-hospital pneumonias. Interestingly, severe strep pneumonias are more rare in adults than in children. However, when the season strikes, hospitals become overfilled with pneumonia patients. Lowering the incidence of strep pneumonias is incredibly nice, and also there is some mortality benefit. Strep pneumonias in adults are not without its harms, however. While younger adults tolerate it really well, the elderly start experiencing many of the same problems that children do. Their immune system is very weak. Reactivity lowers and allows for the disease to spread wider. On top of it, elderly persons amass other diseases, which can all be exacerbated by accompanying respiratory failure. Severe pneumonia resulting in sepsis is a rather common cause of death in elderly patients. Treatment of strep pneumonia is fairly straightforward and pleasant. The simplest of antibiotics work most of the time. Some countries like the US that actively used oral penicillins to treat pneumonias have higher rates of strep resistance. In many other European countries, strep antibiotic resistance is almost non-existent, and anything you administer will likely kill it. More severe cases will obviously require complex treatments that I won't be talking about here. Meningitis and sepsis. These are much less benign forms of infection, and we'll see exactly why later. Meningitis alone is very treatable and generally associated with very low mortality. Sepsis, however, is a major issue with high mortality rates. Even proper antibiotic treatment can fail to give us positive outcomes. Discussing the hows and whys of it is far beyond the scope of this talk, so let's just focus on the vaccines. There are two main types of vaccines on the market, but both of them share the same component, the capsule polysaccharide. Since there are many circulating serotypes, vaccinating against just one is plain useless, and developing vaccines against every single one will result in way too many shots. To solve these issues, manufacturers started adding together several polysaccharides into one vaccine. This process is known as conjugation, and these types of vaccines are known as conjugated vaccines. Currently, the most widely available type of conjugated vaccine is PCV13. It contains 13 capsular polysaccharides attached to diphtheria toxoid, which acts as an adjuvant. This type of vaccine induces strong and long-lasting immunity. The other type is known as polysaccharide vaccine. Currently, the most widely available one includes 23 serotypes, and there are ones in production that include all the way up to 70. The problem with this type of vaccine is that it doesn't contain adjuvants. Thus, the immune response is weaker, and generally only limited to B-cell activation and formation of antibodies. T-cells don't get involved, resulting in weaker response with no cellular component and no formation of memory cells. We've seen a similar problem with early versions of Hib vaccine, as you remember. In older adults, the vaccine may not induce any immune response at all. For the same reason, it's not used in children under 2 years of age, as it just simply won't induce the necessary immunity. In cases where the vaccination is mandatory, PCV13 is used for young children. Polysaccharide vaccines, while covering more serotypes, are not effective in young children. PCV13, although covering less serotypes, it covers the ones responsible for 80 to 90% of severe pneumococcal disease. Also, it has a very high success rate, resulting in nearly 100% guaranteed long-lasting immunity. Polysaccharide vaccines are reserved for other special groups of patients. As the patient's immune system weakens, other types of bacteria become a lot more virulent, and the same thing applies to weaker strep serotypes. Poly vaccine is recommended in patients with chronic obstructive pulmonary disease and HIV to prevent severe cases of invasive pneumococcal infections. The immunity is weaker, limited to antibody production, and doesn't last as long, which, well, it's currently estimated to be around 5 years. But this is necessary as it provides at least some type of immunity for those patients. As far as adverse events go, these vaccines are very safe, and side effects are limited to injection site reactions, which are also a lot more common in polysaccharide vaccines, sometimes also fever. No severe adverse events have been described when using these vaccines. The vaccines are almost riskless. All the side effects are mild in nature and mostly limited to injection site reactions. The benefits of using these vaccines are rather long-lasting. First of all, it goes far beyond childhood. Strep is one of the primary causes of pneumonia in adults, and severe pneumonia resulting in sepsis is a rather common cause of death in elderly patients. By vaccinating, we can lower the rates of strep pneumonias among all patient ages, as well as preventing cases of severe infections in young children as well as elderly adults.